to the Prostate Cancer Patient Empowerment Program PC-PEP podcast episode number 3. I'm so glad you joined us for this episode, where we dive into the deeply personal and inspiring journeys of individuals navigating life after a prostate cancer diagnosis. I'm your host, Gabriela Ilie, a scientist dedicated to developing evidence-based programs that empower cancer patients to take control of their health and reclaim their quality of life. Co-hosting with me in future episodes will be Dr. Rutledge, a prostate cancer oncologist from Nova Scotia, Canada, and my co-founder of PC-PEP. Together, we've built programs that go beyond treatment, programs rooted in patient feedback and designed to provide practical tools to help us lead better quality lives. Today's guest is Joseph Linton, a graduate of our PC-PEP program. Originally from England, Joe moved to Ontario, Canada, to start a new chapter with his wife. Shortly after arriving in Canada, his wife suggested, let's go get checked to the doctor. And that led to his prostate cancer diagnosis. A diagnosis that came with no symptoms, no family history, and no warning signs. Despite living a healthy lifestyle, plant-based, since the age 14, physically fit, and rarely needing medical care, Joe was faced with the challenges of a prostate cancer diagnosis and the reality of the higher risks of prostate cancer among Black men. In this episode, Joe shares how he found meaning and resilience through the highs and lows of his journey, from becoming a grandfather soon after the surgery to navigating the emotional complexities of relationships impacted by his diagnosis. We'll discuss the role of prayer in supporting mental health, reflections on masculinity, and how Joe's former work with Black men and mental health shaped his own perspective on healing and self-care. Joe's story is a testament to the importance of community, connection, and programs like PC-PEP, which empower men to take charge of their health and address the emotional, relational, and physical dimensions of prostate cancer care. If you're interested in joining PC-PEP, our program is freely available worldwide for anyone who speaks English or French. Visit pcpep.org for more details. For those not interested in a research trial, explore cancerpep.com, where we offer tailored programs for all cancer types. Thank you for tuning in. Let's dive into Joe's remarkable story, one that reminds us of the power of resilience, vulnerability, and the human spirit. Together, we're not just navigating prostate cancer, we're redefining how we live with it. Welcome, everyone.
So, Joe, thank you so much for agreeing to do this podcast. I'm just so fond of your presence in the program, the friendship that we developed since you entered the program, and I'm just so deeply humbled and grateful to you that you're taking the time to start those conversations with me.
Yeah, it's a pleasure. It's a pleasure, Gabriela. You know, it was my it was actually my surgeon who suggested, actually, you know, that I get in touch with the PC-PEP program.
Mm-hmm.
And I've never looked back since. And that was in January of this year. And I had the operation, and then I think I left it until I wasn't feeling so sore to join the, then I could get involved in the exercises and stuff, to join the program. And that was probably the beginning of February, I think. I was a month after I started the program. After I had the operation. Yeah, and since I've been involved with the program, I think it's been a godsend for me. It's helped me in my recovery, and listening to other men and what they've been going through has really helped and strengthened me as well. You know, so I'm eternally grateful for this initiative that you set up, and I also got involved in the research that you did as well. Those questions, although I found some of them quite challenging, I think there were questions that need to be asked, you know, and it made me think, and I got involved, and I found it very therapeutic, actually.
It's interesting what you're saying, and just before I'm going to ask you to roll back a bit and just go back at the beginning when you were diagnosed. But sometimes when people ask us questions, and even in a survey, they do kind of force us to reflect and maybe take a moment, create some space around those questions about subjects that are very pertinent to our lives. But if nobody asks the questions, then the dialogue only happens somewhere in here, as opposed to bringing up, shedding some light, bringing these issues up. Because the moment sometimes you verbalize them or you start reflecting out loud, that, like you said, that does something to us. There is some healing that happens, even the very acknowledgement of, this is something that perhaps is bothering me, or I need to think about it. I need to think through it out loud. Maybe I need to just verbalize it.
That's right. And there's something about verbalizing your internal world that does, it kind of dispels a lot of the anxiety that you are, because holding it in, sometimes it does have a way of amplifying the anxiety, and when you let it out and you hear yourself speaking, and there's something therapeutic about that. So it's almost a sense of letting it go, pass through into the ether, if you like, and it does help to lighten your burden, especially if you're talking to someone about it.
Yeah.
And then you realize that you're not the only one, who's going through this. Yeah.
Totally. You made me think of that song by Simon and Garfunkel when, hello, darkness, my old friend, I've come to talk to you again. And
Yes.
silence like a cancer grows. When I worry about something and I don't shed light to it, I don't bring it up to the surface, it can erode my soul at some level. Okay, so let's go back. At the time that you received the cancer diagnosis, if we may, Joe.
Yes.
So what was happening in your life? What was going on at the time, and what?
Well, I just I just not long got married. I I'm from England. I spent all my life in England, and during COVID, I was introduced to a Canadian woman, and yeah, we hit it off quite well, and decided to come and settle and get married in Canada. And she said, one of the first things she said, Joe, you need to get yourself checked out, you know, go to the doctors, so
God bless those wives, I tell you. I hear this story so many times. Honey, you need to get checked out.
yeah.
And for a lot of men, that's how it happens. Yeah.
Yeah, and the thing about it is, for me, um, I've lived quite a healthy life. I've been plant-based since I was 14. That's how
Wow.
dedicated I am to this, taking care of my health and so on. And I've always exercised and,
Mm.
you know, kept healthy and fit. And very rarely, go to the doctors for anything, um, except for the odd antibiotic, every now and then. And so I thought it was just going to be a walk in the park. I thought, oh, I'll get checked out. It wasn't long ago since I had a full checkup in England. It was about a couple of years before, about 2 or 3 years before, and everything was fine. And so I went, I had my blood work done. And I remember the day, um, I was sitting in the car park. I'd gone down, I'd just had a vaccination, a shingles vaccination. That was another thing that my doctor recommended. So I went and had that done, and had my blood work done. And she said it would be ready within a few hours. So I said, okay. But I didn't realize it was going to be so quick, because I was in the car park after I had my shingles vaccination, and I was just getting ready to drive off, and I got a phone call from, and it was my doctor, and she said, you've got a high white cell count, and your PSA is 9. So I said, oh, not knowing very much about PSAs and stuff, I thought, that doesn't sound too high. So nothing to worry about. So she said,
Exactly. Give me a metric here. What does 9
yeah.
mean? Yeah. Uh-huh.
So,
Uh-huh.
so I didn't worry too much about it. And so she said, I'd like to, it could be a blip, because PSAs are, and they're not definitive. So she
Yeah.
said, we'll do another one. And so we did. And lo and behold, it was 11.
Mm.
So I thought, well, I better get something done about this. So we went to the urologist and had the digital exam. They didn't find anything.
Mm-hmm.
There wasn't anything in there. And so that was a relief. So I thought, oh, maybe this is all just, I was still thinking in that mode. There was an element of denial going on that this isn't really, that they're not getting it right,
Mm-hmm. Mm-hmm.
something, because after all, this healthy me, I've lived all my life, done all the right
You
things.
got the wrong guy.
Yeah. So,
Yeah.
yeah, had that done. And yeah, it came back as having cancer. No, no, had a biopsy, had
Mm-hmm.
a biopsy. And that was, I must admit, I don't want to put any, well, the reality of having a biopsy is very unpleasant.
Yeah.
Anyway, I had it done. And it turned out that out of the 10 samples, I think it was something like 25% of the one sample was cancerous. And it was a, a Gleason score of 7,
Wow.
3 plus 4. So it was a small, it was moderately aggressive, apparently they said. So I thought I better do something about it. And there was an option to either have seed radiation or to have surgery. And to cut a long story short, I plumbed for surgery, and I had that done in January. But there was still an element of, I was finding it difficult to come to terms with. And I didn't realize, and the gravity of it all didn't really hit me until I developed, after the surgery, I developed a pulmonary embolism. I got up one morning and I could hardly breathe. It was very painful. And I felt awful. I told my wife, and she drove me to the hospital. And when I told them my symptoms, they said, right, Mr. Linton, you're next.
Wow.
And it was in a crowded waiting room, so it must have been quite serious. And yeah, and they did the scans on me and found that I had pulmonary embolisms in both lungs. So they put me on blood thinners,
Mm-hmm.
and that worked within about 3 to 4 days. Began to feel an ease in the pain of breathing and so on. But um, yeah, that really hit me for six. Then
Yeah.
realized this is no walk in the park.
Mm-hmm. What were you thinking? So you get the diagnosis. It's clear you're going to go for surgery now. What was going on through your mind? Were you able to sleep at night? Um, were you worried? Were you worried about yourself? Were you worried about your wife? What was going on through your mind?
I was constantly telling myself, you're going to be all right.
Mm-hmm.
Um, I got it early.
Mm-hmm.
Um,
Yeah.
doctor said, well, it wasn't at that time actually, but he said, he was very supportive as well. So, and my wife was quite supportive too. She was, practically, she was there, in a practical sense. She's a very pragmatic woman, she was there for me and made sure that I had all the comforts and support that I needed. Um, I tend to feel quite isolated when I'm ill.
Yeah.
And I think it's because I have a tendency to withdraw
Mm-hmm.
and a tendency to want to fix the problem myself.
Yeah.
For I don't really share my anxieties and my fears. and people get a sense, or they get the impression that I'm quite strong,
Yeah.
but deep down inside, I'm really hiding, feelings of vulnerability
Mhm.
and fear.
Mhm.
And I think that's what I felt. If I'm honest, I felt quite vulnerable and quite afraid.
Yeah. And to normalize, I hear that a lot from men because men are expected that there is something about the role that they hold in the society. You know, you are the dad,
Yeah.
you are the man, you are the spouse, you hold the reins of the family. So women, at least, you know, I speak for myself. I look up to my husband, you know. Something is the matter. I come home, I tell him, like, I rely on Rob saying, it's going to be all right, hon. We'll figure this out. It's going to be all right. Even if we don't have a solution right on the spot. But there is something about this relationship, those roles that we enter, and the subtle agreements that we have with each other,
Mm.
that I'm going to rely on you for certain things. And that between the two of us, you represent the strength, you represent the stone, we'll figure it out because, Joe is there. Joe is going to figure it out. And so in a moment like this, you finally probably find yourself in a difficult situation, in a different situation, because you might feel that the rug is being pulled from underneath you and you don't have answers to some questions. Have the doctors at that point talked to you about how African men and Black men are much more prevalent to get a prostate cancer diagnosis? The prostate cancer diagnosis is much more prevalent among Black men. This whole thing. Did you know, actually? Did you know at that time?
I did know that.
Yeah.
And I'm part of a church group. And I remember when I was in
Yeah.
England, that one of the there was a church member who invited um, a prostate cancer representative, outreach
Mm-hmm.
representative, and he came to the church and he gave a talk in the afternoon about prostate
Mm.
cancer and about, the prevalence of it in the Black community and that sort of things, and things to look out for. So that was quite a while ago. So I was quite, um, I was very much aware of that. But I
Mhm.
never thought that it would be something that would affect me.
Right.
I was keen on encouraging other Black men.
Yeah,
Get yourself
because you're
checked.
fit, you're eating well, you're
That's right.
taking care. Absolutely. So, from a healthy living habits point of view,
Yeah.
you're very, very mindful, making
Yeah.
right decisions, right?
And I had no symptoms.
And you had no symptoms. Yeah.
No symptoms at all.
Yeah.
There was no pain, frequency,
Yeah.
no irritability. Looking back though, and when I look after I've done the Kegel exercises that
Hmm.
I learned to do on the course, I realized that I did have a weak bladder.
Mhm. Yeah.
Looking back now, because my bladder is now stronger than before.
Ironically, yeah.
Yeah. And
Yeah. Yeah.
that is due to the Kegel exercises.
Mm-hmm.
And I realized that I'm sleeping all through the night now without getting up.
Mm-hmm.
Whereas I'd get up once, at least once in the night. And
Mm-hmm.
I don't do that now. And I'm realizing that, oh, that was because probably you were, having symptoms of some sort. There was something going on, but you didn't pay much attention to it.
Yeah.
Didn't link it to that. Yeah. So yeah, I was aware of it, and
Mm-hmm.
having worked in the field of health all of my life, I was keen on encouraging people to look after themselves, and especially Black men, get yourself checked out and so on.
Yeah. Yeah. Yeah,
So
that's why we love you in so many ways, and you're just so wonderful in our monthly video conferences because you speak from the heart. You're not afraid of your vulnerability. You embrace it, and we say in the program. In fact, we is one of the pillars of the program to communicate as clearly as we possibly can that vulnerability is strength, and
yeah,
you really get your power back when you're able to look at that and say, okay, I'm going through. a difficult time because I'm unfamiliar with those circumstances. I'm unfamiliar
Mm.
with having to navigate my life given those circumstances. That is normal. It doesn't mean that it just is normal. I'm unfamiliar with the circumstances. And when you say that, when you bring that silence and you vocalize it, that becomes power, and that becomes a process whereby you take your power back. And when you verbalize it in a group of men, you gave them power to take their power back as well. It's really powerful stuff. It may seem like peanuts, nothing, but it's such a powerful process. And I think back again to how grateful I am that you agree to have those conversations with me where we get to talk about things like this, that we don't have to give them power over us. Quite on the contrary, they're elements of empowerment, and they're elements of education, because now we can educate one another, to say, how do I get my power back? I lost my power to this diagnosis. I lost this power to a lot of side effects that come with the diagnosis. I don't know how to leave my life back. I feel like I have no control. It's taken over me. I'm constantly at its mercy. And yet there is a way to get it back. And one way to get it back is through this softness, through this, wait a minute. Yeah, I feel vulnerable inside. I don't know what this is. It's okay to say, I don't know.
Exactly. I think that's one of the most important disclosures that you can, verbalize, is that you don't know. And I think for some, especially men, yeah, for all of us, as women too, that
Totally. Yeah.
it's hard when you're faced with a tough question, you feel that you should know the answer for some reason. But it's probably better to admit that you don't know. Then you can really find out. Then you're in a position then to know, because if you can't know everything, and to be able to say you don't know, as you say, is power in a way. It's a gateway.
So, yeah.
A gateway to
It is.
knowing
Yeah.
and growth.
Part of the program, and I know we're jumping back and forth, but it doesn't matter. Part of the program, we talk about this imago technique, and it's a technique where you communicate with another, um, and you become a listener, you become an observer, you become a companion to the other person. And to be able to do that, you have to embrace that. I don't know. Let's see where this person takes me. I don't know. I don't know what they're thinking. I don't know where they're feeling. I don't know where they're taking me with this. And chances are they don't know either. So, and I'm willing to say that I don't know. Show me. Let's see what we see when you guide me along the way. It's part of the imago technique. And it's a very powerful technique developed by Helen Hunt and Harville Hendricks. And part of that whole process, I know they've done a lot of studies, and they looked at the human brain. What happens when you're curious, when you say, I don't know? The brain changes, and it allows, it's almost a spiritual experience when you embrace the I don't know. It becomes a precursor to healing. It isn't that interesting? It becomes a precursor to decrease in anxiety, instant decrease in anxiety. Don't know. It's okay. I don't have to carry all this weight of, I need to know. I need to have it figured out. I don't know. Imagine that. How did you manage the whole treatment process? Were there any tough spots for you? Were there any things that surprised you, Joe, along the way? What was that like?
I think the biggest it was the biggest thing for me was the complication with the pulmonary embolism. Because on one hand, I was getting better. The healing process was going along nicely. But then what slowed things down and what worried us as family, was the pulmonary embolism. And that kind of complicated things and slowed things down. Yeah, it was quite frightening because I was so exhausted because my lung capacity was restricted, and therefore I lost energy. I didn't have any energy. I was losing energy, and there were days when I felt really bad, and I couldn't walk very far without feeling pain. So that was really difficult. And until that was under control, when they put me on painkillers and blood thinners, um, it took a while for that to sort of, have effect. And it took about 3 or 4 days for me to begin to feel that I could get up and start moving around. And I guess the biggest problem for me was the helplessness.
Mhm.
Um, I'd never had a major operation before, and I had to give myself over to. It was like being in a. I was in nappies. I had this tube hanging out of me, which was just awkward, and sometimes it was uncomfortable and awkward. Um, yeah, so that whole process, that first month was quite difficult, coming to terms with the helplessness,
Mhm.
and and that caused a little bit of tension, I think, in my relationship because I'm such an independent person, and I try to do things as much as I can for myself. And sometimes I can be very defensive about my independence, but when I needed to get up to go to toilet for anything, and I was looking a bit wobbly, my wife would, try and help, and I would convince her, I'm fine, and then it sort of, and I realized that I think my biggest problem is that I need help, and
Yeah, yeah,
to let go and admit that you can't do it, you need help.
yeah.
Um, that was the biggest hurdle for me, is to come to terms with letting go of the independence and admitting that you need support. You need that physical support. And
Yeah, yeah, it can be it can be difficult. You're so used with doing things and helping others. You're the one that is the helper. All of a sudden the roles are reversed, and that it's so interesting in so many ways, because on one hand it's a curse. Look, I feel so frustrated. I was able to do this before. This is ridiculous. I need to be dependent on, and on the other hand, what an incredible opportunity to realize that, wait a minute, I need help. That's okay. I'm going to need to give my wife just the ability to enjoy giving me something that I used to give her back. So she can have that same experience of what it is like to do something for me. So we a little bit of a role reversal, you know.
that, that is a very valuable thing. We don't realize sometimes how important it is to to be vulnerable and to admit to help, to feeling helpless, and what a therapeutic admission that can be for the relationship, because then the partner has value, you know, in your a sense of value and a sense of contributed to your healing.
Totally.
And you deprive someone of
Totally.
yeah, the
Yeah.
opportunity
Yeah.
to help
Yeah.
you in your healing.
Yeah. And you know what? I'm listening to you right now, and I feel such joy within that, because here we are, most podcasts of this sort are happening between a guy interviewing a guy about what it means to have prostate, and that I'm sure there's value in that. But thank you for, I love this, because here I am, a woman, and I'm part of this program, and we're having this dialogue, and I'm so excited because that's what we're experiencing in our own relationship. And because Rob and I prescribe, describe, and also demonstrate, so we're not ashamed to tell you that we are playing this back and forth ourselves. I mean, we are getting older. There are times when Rob is sick and he's coming like a puppy to me, and it feels so good, Joe, to be able to show him that sort of, love and affection and support that usually he gives me, it feels so empowering to me as well. And I recall once reading this very powerful book that said that, as we grow older, because of various challenges that we face, both men and women, right? We have no choice. It's like the universe has conspired to put all those challenges in front of us so that we may let go of the arrogance, embrace vulnerability, see the strength in it. See, and become more fuller and come to know each other and become more complete through one another by letting go of those prescribed roles and prescribed, no, but it has to be this way. I do this, you do that. There are boundaries. Yes, there are, but there's so much growth that we can afford in situations like this, where the roles are reversed.
Yeah.
Yeah, we're much happier in our relationship, and we've grown so much because of this program as well, because we have no choice. But the only way to be in this program, and we knew from science, was to be alongside with everybody and explore, what does it mean to be vulnerable? What does it mean to have the roles reversed? What does it mean to not know and not have answers?
And to not be able.
And not be able. Yeah. As much as you want to not be able. Looking back, so it's been now almost 11 months since this prostate cancer journey, almost a year. Almost a year for you. And I know that we kind of touched on this already, but how did the treatment affect your mental and physical health? For the best, for the worst, what do you make of it? At this point, at least. I'm sure things will change as years goes by, but right now.
Yeah.
Mm-hmm.
The recovery, the physical recovery has been good. And I guess that has helped, that, my mental state. I guess it's difficult because it took a toll on my relationship. It took a toll. I must admit, it took a toll on my relationship. And we're separated at the moment. So, and that happened about a month, about 2 months after, 2 or 3 months after my op. And so that was devastating. And I've been having to cope with that. I now live on my own. And that has been very, very difficult to come to terms with. But so emotionally, and I'm wondering, did it have something to do with my diagnosis? I've been reassured that it doesn't, it's other things. And then I have 3 children in the UK, the 3 adult daughters. One of them is in a relationship with a baby. So interestingly, that came in April. And so I became a grandfather. So it's been extremely complex. It's been highs and lows of the extreme. And but I also have a very strong Christian faith that has and a very strong prayer life that has really kept me together and has helped me to process and has given me a sense of a tremendous sense of I felt supported because I'm part of the church community. So that has been a tremendous of great value to me in helping me navigate all of this. My biggest worry was my children and how it would affect them. I managed to go to London. I managed to go to London in April to meet my granddaughter for the first time, and I spent 3 weeks there. And my friend said to me, "You're smitten," you know. And I was, I was still in recovery mode. I was still in pads.
Yeah, yeah,
I was
yeah.
leaking all over the place. My daughter had just come out of surgery. She'd because she had a cesarean, she couldn't lift
Right,
anything, and she
right.
couldn't hold, she couldn't lift her partner was out to work in the day, so I was there cooking, cleaning, shopping,
Yeah, yeah.
and taking her to her appointments at the hospital, holding the car seat with the baby,
Wow, wow.
and then yeah, running up and down London with my old, friend from teenage years, 2 70-year-olds, sort of running around London, and yeah, so it's been an adventure
Mm.
of extremes, of great
Yeah,
highs and great lows. Um, but as far as the prostate issues are concerned, I managed.
yeah,
I managed. I took pads with me. I had to
yeah.
run around London up and down. I was going through about 3 or 4 pads a day. And I'd just find a public toilet, go in and just change, and just I'm off again, And
Yeah.
I was careful of what type of clothes I was wearing, and wasn't wearing jeans or anything. I was wearing joggers that I could easily pull down, pull up. They were soft and comfortable to wear. I was doing Kegels on the tube, on the buses and the trains between journeys. Um,
Absolutely. Nobody knows what we do in our pants. It's
I
our
know
business.
exactly. Who should know?
We do it anywhere in the elevator.
Yeah. So yeah, I managed, and each day I noticed an incremental tiny step of improvement
Yeah,
each day. And by the time I left London, I was down to about 2 pads a day
yeah. Oh,
within the 3 weeks that I was there, and sometimes one, depending on how much lifting I had to do and that sort of thing. Um, Yeah, I wondered how I was going to manage, on the flight. Would I be to and fro and to the toilets and things like that? But it was nothing like that at all. I was quite stable. And
yeah. Yeah. I love what you said about how it's been some extraordinary couple of months of ups and lows, ups and downs. And boy, isn't that a great description of life? I mean, that in itself, what beautiful cognitive restructuring, because that's how life goes, it goes up, it's high, it's really high, and then it goes down, it's, oh boy, I hit the bottom, and up again and down again. And that's the nature of life for you.
that's life. And
That's life.
before I came to Canada, I had spent 3 to 5, I think about 3 years,
Yeah.
caring for my wife, my first wife, who had bowel cancer.
Oh,
Then she died um, in 2018
mhm.
on my mother's birthday.
Oh my
you
God.
know, and
Piling up one over the
yeah,
yeah,
and then
yeah.
yeah, and I'd just gotten over that. Then I met my wife, and I came here, and cancer diagnosis. The white cell count was another issue because they discovered
Right.
leukemia, but it was but they said not to worry. But it took a while. To cut a long story short, it took a
Yeah.
while. But they discovered that because they couldn't understand what it was about.
Yeah.
And they came to the conclusion, the diagnosis that it was a form of very slow growing leukemia. They said it was indolent. So I have it, but it's so slow growing that it would probably, in my lifetime, you know, I wouldn't affect me.
Right.
But there's no treatment
Right.
for it, but there is surveillance. So I
Yes.
go in every 4 months for my blood to be tested and see if there's if there's a likelihood of it, changing or anything like that. But so that was another big whammy,
Oh, yeah.
hit me because we didn't know what it was. And the word leukemia was being bandied about. So
Yeah.
knowing exactly what type of, what sort of, what they meant,
Oh, Joe, it's
was a
like
massive.
really when it rains, it pours.
Yeah. And it was like an avalanche
Yeah.
of stresses
Yeah.
that I had to cope with.
Yeah.
But thank God for prayer.
Of that. And I want to come back to that. Thank God to prayer. Yeah.
Yeah, because that's my saving grace, really.
Yeah. Yeah, it is. It is.
That's the thing that has held me together. That hope, especially the 23rd Psalm.
Hmm.
The Lord is my shepherd; I shall not want. You know.
Interestingly enough, we had to decide at the beginning, I had to decide what questions go in those questionnaires, which of those measures I let go of, which ones I include. And I picked up what they call a golden standard questionnaire for quality of life, the SF-12. It has a mental health component, it has a physical health.
Mhm.
But then I came across this one that I really liked, and I showed it to my colleagues, and they said, well, got to be careful. You don't want to overwhelm people, ask too many questions. And I'm so happy that I allowed my own gut feeling kind of be informing me as to what I should do. Because speaking to patients, I realized a lot of them brought up the issue of prayer.
Mhm.
Prayer matters. In prayer is me and me. I'm there with God.
Yeah.
And I summon to something much greater than me. It's
Mhm.
enormous healing that happens in that. Because it's back to I don't know.
Yes.
I
Yes.
don't know, and I'm going to lay down in this pasture of unknown and trust you and know that your will and your light will get me through this somehow. That somehow is going to be all right. So I decide to include this questionnaire. As you know, it's part of the survey. And it asks questions about your faith. And it has a spiritual component to the idea of quality of life, because the patients were saying, no, prayer matters. Lo and behold, we look at the data and we published the results showing clearly that among prostate cancer patients that had a faith, they believed in something greater than themselves. And they were in the habit of praying. They went to church. They went, they succumbed to God. They asked for help. They asked for guidance in moments of uncertainty, in moments of, I don't know. And the results show clearly scientifically, as do many others. But in our own lab, we show that those men that had a faith and a spiritual practice were able to overcome the challenges of side effects much
Yeah.
easier. They had better mental health and they had better quality of life. And when faced with uncertainty, they felt more empowered and they had higher levels of what we call self-efficacy, thinking that I can overcome difficult situations. And that does play a role in health and healing. So
I,
it is a very important element to pay attention to.
yeah. I certainly believe that.
Yeah, me too. Yeah,
Yeah.
yeah,
That have that connection with God
yeah.
has been vital,
Yeah.
you know, to my life, but also to my recovery and the ups and downs that I've been through over the past 9 years. I wouldn't be here. I wouldn't feel so at peace. And I do feel a sense of peace. And I feel quite hopeful about the future as well.
As you should be.
Yeah.
Yeah, yeah, totally. There's that saying, there's this poem by Rumi that says, I'm not this skin, I'm not this hair, I'm not this skin, the spirit that
Yes.
lives within.
Yeah. Oh, that's a good one. Yeah.
Isn't that a good one? So therefore, why shouldn't I be okay no matter what?
Mm.
No matter what, because in the end, is even as a scientist, I try to make it my. I believe in God, so I don't shy away when I go to big meetings and even the other day I got an award, and I thank God. I
Yes.
don't shy
I think
away. It's just,
that's right. I think my late wife was quite an inspiring personality. She was very vivacious and very successful in what she did, and she kind of had an international profile in what she did.
yeah.
And she'd say, why me? And
Mhm.
she said, I don't believe in that. She said, why not me?
Ooh.
know, who am I? You know,
Ooh.
why not me? And then,
Really?
and I took a lot of inspiration from that.
Yeah.
She was quite courageous and determined. Um, why not me? She didn't want to feel sorry for herself
Yeah.
or anything. She just she embraced it, and said she's willing to accept whatever came her way, whether life or death. Unfortunately, it was death, but
Yeah. In part of the PC-PEP program, I think we talk a lot about, as this is a program, as you know, that is meant to empower patients and share all the science that we've gathered that has helped other people. So the question that we always like to, bring all of us to is, radical remissions do happen. Why not me? Not
yes,
me.
yeah,
Why not?
yeah.
Yeah.
One thing I do like about the program is it has a kind of a holistic approach. You're dealing with diet, you're dealing with health, mental health, and you're dealing with the physical um, aspects. And that appealed to me because I spent all of my life in mental health,
Right.
all
Right.
of my working life in mental health, encouraging and especially working with the Black community.
Right.
I spent a lot of time near to the end of my career in the National Health Service in England as a psychotherapist
Yeah.
and helping um, people, especially Black men,
Hmm.
look at their mental health uh, because it was quite noted that um, Black men didn't or mental psychological treatments weren't often um, offered to Black men, that they were more likely to be treated in high dependency mental health units on medication as a sort of a chemical straitjacket.
Hmm.
And my work was trying to sort of um, encourage, the medics, the psychiatrists to think more in terms of, what can you do? Get the diagnose, get the patients early, uh,
Yeah. Yeah.
and yeah, offer, psychological help rather than, this draconian high dependency
Mm.
treatments that they so often seem to get. And so that's one thing I liked about the the the, the holistic approach, the mental health aspect of the PEP program,
Yeah.
and trying to focus on promoting um, early detection
Yeah.
in
Yeah.
see,
Yeah.
which
Yeah.
I think
It's,
is
so
important.
whoever's listening to this podcast, do know, Jens, that all it takes is just a blood test. Go and see your family doctor and say, hey, especially if you're young,
Yeah,
35, even 30 and up, and you're a Black man listening to this, go to your family doctor and say, hey, I want to get my PSA checked. The sooner the better. It's such an easy thing to do.
yeah,
And it's so important. Thank you, Joe, about the multifaceted aspect of the program. That's something too that we learned very soon into the development process of the program. Is that when you offer a man more of the tools they need to help themselves become empowered on this journey, the better it will be, because then people pick whatever works for them, leave the rest. But it will be a much better fit if you offer them everything rather than, oh, just saying, we're just going to exercise. Exercise is really important for you. Let's just focus on exercise, or diet, or let's just do Kegels. And that's another thing that we're learning now, why so many Kegels programs within hospitals are not effective. And we spend so much money and resources making sure that we have a pelvic floor physiotherapy nurse. Unfortunately, men don't necessarily take advantage of those services. And it's very simple. How many things do you think you're going to have in line saying, okay, I would like to have a probe that is going to go up my anus and is going to teach me very specifically which muscles I have to engage in order to engage my pelvic floor and be very few men. They're going to run the other way. They're going to say, you're not touching me. No, thank you very much. Whereas a program like this, where it has everything under the sun, diet, exercise, social support, relationship and intimacy training, live sessions, online sessions, spirituality. And then we also teach you about Kegels, and Rob talks to you in a very simple way and say, hey, this is how you find out if you're engaging the right muscles or not. And you do that in the privacy of your own home. There's nobody there sticking anything anywhere. You're much more likely to adopt this. So now we're learning, okay, so we can save some money to the medical system and perhaps make a program like the standard of care that is convenient for men and accessible. You're giving them information in a manner that preserves their privacy and also their dignity. There are some issues here that we ought to think about.
And it's great because it's all done with a tinge of a sense of humor as well.
Humor, yeah.
I found that the nuts to the guts.
Nuts to the guts.
Hilarious. I thought, okay.
Because that kind of makes sense. Everybody knows they're nuts and everybody understands how. Okay, so let me try to move them. Yeah. That's the pelvic floor. It's a very simple, humane, and you're doing it at home. Nobody sees you. You're watching Rob, and then you get to meet Rob, and it's very personable. So no wonder why we've developed this community, and we're all very normal. We're not shy to be vulnerable in front of everybody. And every time we get together online, I tell you, Rob and I, we get off the Zoom call at the end, and everybody feels so damn empowered. Yeah. We feel so good. Yeah. At the end of those sessions, it's quite remarkable. Okay, let me ask you something. How did you come across the PC-PEP program? Because I forgot to ask. And why did you decide to give it a go? Did you have any doubts about joining the program at first, or were you in all from the start?
It was my surgeon.
Oh, was it?
Yeah, on my very first meeting with him, he had a diagram of the male reproductive organs, and he was describing to me, exactly where and what was going to be done and how much percentage of the biopsy and everything was cancerous and whatever. And then he mentioned PC-PEP and that he's referred a few patients to the program over the, I don't know how long you've been going, but over the period of time. Anyway, he knew about it, and he referred me. And initially I was looking around anyway on the internet. I found out about Walnut.
Yeah.
The Black Men's Prostate Support Group, and there was one in the UK called PC.
Great resource. Yeah.
It called Prostate Cancer UK.
Right.
And I'd been following them for a little while, but even before my diagnosis. I just sort of signed up just to, but not thinking of getting myself checked out at all because I had no symptoms. Because in England, in the UK, it's quite different. I think the guidelines say if you don't have symptoms, then don't go. You don't need to go. But I don't think that's good advice. And they're saying now that the guidelines need to be changed because especially in the light of one of the very high profile sportsmen, Chris Hoy. So Chris Hoy, who was one of the most decorated Olympians in the UK, he's a cyclist, and he got diagnosed with stage 4 prostate cancer.
Wow.
Yeah, and he said, no man in this day and age should be being diagnosed with stage 4
Yeah.
prostate cancer.
Agreed.
You know,
Agreed.
yeah.
Yeah.
So he's pushing it for the guidelines to be changed,
Yeah. Yeah.
for men to get themselves checked out.
Yeah.
But he
I'm
said
so
he's
happy
got
to hear
about
that.
another
Yeah.
4 years
Yeah.
that he's been given that
Yeah.
time. He's quite young, which is
Yeah.
is unfortunate, really.
Absolutely. Absolutely. We have a patient, and we published one of the papers in
Mm,
prestigious scientific journal that said, I went to bed as a 57-year-old man. I woke up as a 75-year-old man. Imagine what that can do to a person. I mean, there are serious challenges that someone can face. This need not be.
no, no, yeah.
This need not be. Can you share your experiences during the PC-PEP program? Is there any particular part that stood up for you?
The group meetings, the monthly group meetings. The one thing that I found difficult to do was the relaxation,
Mindfulness,
the
meditation,
yeah, with the
with the
monitor,
biofeedback
with the
device. Yeah.
biofeedback monitor. That's right.
Wow.
I found that I was working to it too much. I found it interfered with the relaxation. I was concentrating too much at trying to get it in the green. You know, uh, um,
You are trying to work the machine.
yeah,
You said,
that's
forget
right.
about how I feel. Let
I
me tell
found
you
out
how
that,
what you should show.
so I stopped doing it.
Yeah.
Stopped doing it. I found that difficult.
Yeah.
Um, so I did it on my own,
Yeah.
without the machine. And
Prayer.
yeah, yeah, I found out that, I was working towards the machine too much, trying to beat the machine, if you like.
Those competitive men.
Yeah.
That's so good. That's
Yeah.
so good. And prayer
So
does it. I mean, yeah.
I stopped doing the machine, and I found the Kegel exercises of tremendous value, and the advice about diet, that was good. I learned a few new recipes. And I thought I've got some to share too, being plant-based.
Yeah.
Uh, that it's ongoing, that even though I've finished the program,
Yeah.
I still like to be involved.
That's it.
I would like to play an active role as much as I can with it, with the program. If I
Yeah.
find some way of, using my journey, if you like, the experience of my journey to share it with others, that would be great.
And we're so happy to hear that we're going to be looking at ways to speak to Black men, to empower them and have them dodge a bullet of being diagnosed with high risk prostate cancer. This need not be anything that we can do to raise awareness, but also empower men before any kind of diagnosis. Why is it that Black men can't embrace, or any man for that matter, healthy
Yeah.
eating habits right now? We don't need ultra processed foods. There is another way to feed our bodies, to decrease inflammation, to move our bodies, to love, to embrace other people's interests as one's own, to create a sense of community and purpose and live a purposeful life now. We don't need to wait for a diagnosis to start, merging those things and making them a priority in our lives. We can do this right now.
Take responsibility for your health, isn't it? That's basically. I found it difficult. I find the biggest problem it has been in the UK is having if you like, a national health service in a way that it's free at the point of access, um, But
Right.
somehow that also kind of breeds a kind of complacency in the community, I think, a little bit.
Yeah.
That I can go to the doctor at any time, and I think when you have to pay for something, and not promoting a private health service, but there is something about giving value to something,
Yeah.
but if you pay for it, and you will look after yourself more. Um, that's the theory anyway. I don't know if it really will work, but
We are working with colleagues in Wales to get the program starting in UK. Of course, right now, any man from Wales, from UK, or any place in the world can enroll in the program for free as part of a research trial. So they have to do some research and give back in terms of their data. But PC-PEP.org can get them there. But our hope is to really have a site in Wales, the first site in UK. And make the program available there so that they can make it available as part of the medical system in UK as well. It is quite a process, and I know yeah,
it's needed. It's needed. Mm.
yeah. And you and I are gonna, this is just the beginning of a longer conversation, and we will have many more episodes where we start unpacking some of those things, the do's and don'ts. What can we do to empower ourselves on the journey? But I do want to ask you, Joe, and it's somewhat of a redundant question because I do know somewhat the answer, and you shed some light on it, but you finished the program, you're still part of the program. Um, how do you feel this program changed you? If you were to name one or two things that you think might have precipitated some kind of positive, empowering change, what would it be?
I think the reproductive area of any especially for men, is not talked about.
Right.
It's only talked about in terms of heroism.
Yes.
I triumphed. I've got
Yeah,
you know
exactly.
how can I put it you, you, without sounding vulgar, but that there is this kind of sense of that the male organ, and that area it's talked about in not in terms of its inadequacy,
Mm,
its failures, but
yeah,
more in its triumphs,
right.
how many women
Right.
you've laid, or how many children you've got, and
Uh-huh. Yeah.
he's a stud, and oh, he's this, and it's talked about in that sort of
Huh?
way.
Huh?
And but to talk about erectile dysfunction and incontinence, and you know bladder issues, and so on, that's not talked about. And I think that being in the program has opened up that aspect of my masculinity, if you like.
Yeah.
You
Yeah.
know, the the having prostate cancer looks at the weak, the vulnerabilities of being a male,
Yeah. Yeah.
basically, and admitting it, that we can't do it, we can't do everything, and we're not masters of everything, and we sometimes we can't get it up,
Yeah.
and
Yeah. Yeah.
sometimes we have to go to the toilet frequently, and sometimes we wet ourselves, and
Yeah.
I think those things need to be talked about. Women talk about them.
Yeah. Yeah.
Women talk about
Mhm.
content. The amount of adverts on the TV for
Yeah.
women's bladder incontinence, but nothing for men. I've never seen a advert for male bladder incontinence.
Yeah.
But we
It
see
was,
adverts for
right.
Viagra, things like that.
Yes. 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 Yeah. Right. Very good
So,
point.
so I think that there needs to be, well, for me anyway, it's opened up that aspect of masculinity, the vulnerability, the dependency, the neediness, and that there's nothing wrong with admitting to it and seeking help. And I think I would support encouragement to do that, to seek help.
Yeah. There is a softness that emerges um, as a result of embracing vulnerability that that gives rise to the spirit from within to come and shine and make us realize that without it, without that sense of palpable presence that we have, irrespective of what's happening with our bodies, there wouldn't be intimacy, there wouldn't be sexuality. And to start a conversation about that really sheds light on what exactly makes this experience of sexuality and intimacy so profound that we all seek it. What is it about it? And you realize the more you have the courage to start the conversation and talk about it, the more you realize that what made you want it and have it is something that you, in fact, never lose. Back to, I'm not this skin, I'm not this hair, I'm the spirit that lives within. What is that? Because that's what shines through. And it is at that level that we can experience a true connection.
Yeah.
That, yes, sometimes happens when all the body parts function well. But you can take, you can have lack of perfect function and still relate with another in a very intimate, profound, present, and all honoring way.
Yes, yes, yeah.
Well, this is wonderful. I know that this is just the beginning of a conversation you and I are going to have.
Great, yeah.
This is part one of many episodes to come from Joe and I in our conversations. But thank you so much for taking the time. Anything that you might wanna say before we say goodbye in this particular episode?
For one, it's been great. It's been a pleasure, and I'm so glad that I've been introduced to the PC. I've discovered PC-PEP. I love the enthusiasm and also the down to earth. And it's science. I mean, it's scientific, but at the same time, it doesn't have that sort of stuffy clinical scientific approach. It's very human, and I put that down to you and Rob's interaction. It's humorous, it's endearing, and it's inspiring actually to see the way in which you interact with one another, and also to be able to share, well, I guess, and talk about a very difficult subject in in a very accessible and caring sort of way, and I found that invaluable because you're talking about scientific things, because this attached to this is the evidence-based, where everything is evidence to what you do, and it can be discussed in a very clinical, detached,
Yes.
impersonal sort of way, but you kind of you personalize it, and you've given it some sort of a character that's it's accessible, and it's
It's
meant to be
personable. Yeah.
personable. That's the word. Yeah,
Yeah. Because at the end of the day, I think it all begins with being personal.
yeah,
And one of the things that we struggle with as scientists, and I found myself on that same pathway as my colleagues, is how do you make what you study and you work so hard for accessible to people so that it doesn't end up on a shelf somewhere, but it translates to actually changing people's lives. And I think the way you do that is to remember we're humans. This science is produced by humans for humans. That means embrace that personal aspect to it, because it's not about some people, it's about all of us. And if you do that, then you grow personally and you grow with your community. You form a true community where you pay attention to what actually matters. You
yeah.
know, yeah, yeah. And that can be a very powerful thing. We've grown so much as I can't imagine, both Rob and I can't imagine doing anything else for the rest of our lives but this. So for us, this is a purposeful life, and that's how we choose to live it, as long as we have time on this planet. So Joe, I am so deeply grateful. Both Rob and I are so deeply grateful for our friendship, because we developed a friendship as a result of it as well. Look, we're talking about things that matter. We want to raise awareness in you, the listener. If you're listening to this, know that go and get a PSA check quickly. if you're a man and if you're over 30, don't be shy to ask for a PSA. It's a quick thing. If you have questions for Joe and I, send them to us, and we'll be happy to answer them. Meanwhile, we look forward to keep talking and having a conversation about what matters most. Why? Because it's personal to all of us. Thank you, Joe.
Thank you, Gabriela.
And this concludes our podcast. Thank you so much for tuning in. For those interested in the PC-PEP program, you can find more information at PC-PEP.org or CancerPEP.org for all other types of cancer. Until next time, be well and take care of yourselves.